Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast. What's up, Everything Medicare Podcast Nation? This is Christian Brindle, wherever you are and however you might be listening to me today. Hope this finds you doing well. Thank you so much for taking some time to join me today on a Monday. I hope you had a fantastic weekend, folks. And it's kind of hard to not pay attention to everything that's going on in our country, and not just our country, but for the most part, the world, more than anything else, with the coronavirus. And that's what we're going to be talking about today. Throughout my lifetime, I have seen a lot of different things kind of sweep the nation, but I don't seem to remember anything having as big of an effect or as much of a panic as much as the coronavirus. Maybe I'm just not remembering. Maybe I'm just a prisoner of the moment, if you will. But at the time of recording this, at the time of bringing you this episode, the coronavirus has reached just under 106,000 people infected on the planet. A little bit over 3,500 deaths on the planet, and you're seeing more and more cases pop up almost on a daily basis. It's kind of hard to keep track. In my home state of Utah, it started out with just one case that I was aware of, someone that was out on a cruise ship on a vacation. They rushed the individual to our largest hospital here in the country. There was a couple more people in southern Utah, and then there's a couple of other people in a rural place known as Tooele. And if you know Utah very well, you know those areas. But if you don't, just know their places in Utah. New York has declared a little bit of an emergency status, as has northern Italy. It seems to be kind of sweeping around a little bit quicker than we find comfort for. And if you tried to go to the grocery store in a lot of places, and this isn't the case everywhere, but at least in my area, and I know it's in other areas too, you'll have trouble buying things like toilet paper, water, and other, household supplies, because people are buying up all the supplies they can to kind of stock up due to the event that there is an outbreak in their area and they might not be able to leave their homes, and they want to be able to have supplies. And like I mentioned, we've seen the Ebolas, we've seen the swine flus, the bird flus, everything that's gone on. So all of this is not exactly a new thing. But that being said, it's definitely something that needs to be very, very taken. I guess the term would be, it needs to be something that's taken very seriously. It needs to be something that is paid attention to. And on Friday, I believe it was Friday, it might have been a little bit, maybe a day or two before that, the Centers for Medicare and Medicaid Services, also known as CMS, issued a statement that Medicare is going to be covering the coronavirus, at least tests for it. I'll kind of read you an email that was sent to me by healthcare.gov, which, sends out some information about marketplace plans and Obamacare insurance, but also about Medicare as well. And I thought it would be appropriate for me to read this statement for you. Okay. All right. So it says, it's titled, CMS Develops Additional Code for Coronavirus Lab Tests. Today, the Centers for Medicare and Medicaid Services took additional actions to ensure America's patients, healthcare facilities, and clinical laboratories are prepared to respond to the 2019 novel coronavirus, COVID-19. CMS has developed a second healthcare common procedure coding system code, and that code is HCPCS. Again, I'll say it, HCPCS, that can be used by laboratories for bills for certain COVID-19 diagnostic tests to help increase testing and track new cases efficiently. In addition, CMS released new fact sheets that explain Medicare, Medicaid, Children's Health Insurance Program, and individual and small group plan coverage for services to help patients prepare as well. A statement was put out by Seema Verma, which is the CMS administrator. CMS continues to leverage every tool at our disposal in responding to the COVID-19. Our new code will help encourage doctors and laboratories to use these essential tests for patients who will need them. At the same time, we are providing critical information to our 130 million beneficiaries, many of whom are understandably wondering what will be covered when it comes to this virus. CMS will continue to devote every available resource to this effect as we coordinate with other government agencies to keep the American people safe. HCPCS, which is the second code that has come out, is a standardized coding system that Medicare and other health insurers are using to submit claims for services provided to patients. Last month, CMS developed the first HCPCS code to bill for tests to track new cases of the virus. The code is used specifically for CDC testing laboratories to test patients for SARS. The second HCPCS billing code announced today allows laboratories to bill for non-CDC laboratory tests for SARS, but also for the coronavirus. So basically, folks, what does this mean? What does that all mean, and why does it matter to you? Well, I wanted to start this out by saying, if anybody that's listening to us has the coronavirus, I'm so sorry. I'm so sorry to hear that you have this. But the good news is, I believe that if you seek treatment immediately, that for the most part, I think it's not as serious as they might probably make it out to be. I think it is serious if you don't get tested, and I think there are certain cases that are more serious than others, I should say. Granted, I'm no health expert. We all know this. I'm no doctor. I'm no health expert. I'm just a guy with a microphone that talks to you about Medicare, insurance, and all that stuff on a weekly basis, folks. So take that with a grain of salt. That being said, in the same time period that the coronavirus has been kind of sweeping the nation, I'd say probably 10, 20, 30, I don't know exactly, but 10, 20, 30, somewhere in their times, as many people have been diagnosed with the flu and have probably died from the flu. An enormous number larger than the coronavirus have been killed by the flu in the same time period. So I don't think that this is necessarily a planet killer. I mean, or something that's going to wipe out our population. I had a friend tell me the other day, that he thought that it was like, the Black Plague or something like that. I'm like, come on. I'm like, get out of here. I'm like, the Black Plague wiped out half of humanity in the Dark Ages. And this has wiped out 3,500 people. And of course, it's horrible. We don't want to see anybody pass away due to the coronavirus. But I believe that it is not possibly as serious as they might make it out to be, but why take a chance? There's still so much that we don't know. And I think this is encouraging to know that the Centers for Medicare and Medicaid Services are continuing to put out new codes that can be used for providers to bill your Medicare plan and bill Medicare so that you can get tested and kind of get the care that you need. And I expect that we'll probably have more updates on this to come and more codes to come out. I have to take a quick break, folks. Hear from this week's sponsor. Don't go anywhere. I have some final thoughts I'd like to share with you. This is only going to be a 2-segment episode, so stay with me. Don't go anywhere. I'll be right back. Welcome back, everybody. Thanks so much for sticking with me through that break. There's a lot we don't know, right? There's a lot of information that comes out every day. You see, cases pop up, and it's starting to get to the point where you're seeing cases pop up all over the country. While I'm on Google right now, there's some live updates. U.S. death totals to 19 people from the coronavirus. Italy considers locking down a center due to outbreak. New York is possibly going to declare, an emergency And there are, of course, people that are stuck on cruise ships around the world that are basically quarantined. So there's a lot that has to go into this. There's a lot of information we don't know. My advice to you, and everything that I've been told, is that if you know someone's infected, of course, stay away from them. It's highly contagious. Right? Wash your hands frequently. Should be doing that anyway. It's still technically flu season. And it's probably not a bad idea to have some supplies on hand, but do you need a bunker? I don't know about that. I think it is encouraging that, the Centers for Medicare and Medicaid Services are, putting out new information and also putting out ways that your Medicare can be billed if you do have it. So if you do have it, hey, feel free to get tested. Just make sure, and we're probably going to have new codes coming out every day and updates from the Centers for Medicare and Medicaid Services. So just be safe out there, folks. Be safe. I mean, this is something that is brand new. We don't know a whole lot about it. Hopefully it'll be a thing of the past. Hopefully it'll be an Ebola. Hopefully it'll be a swine flu, a bird flu, a SARS. What was that other one? It was, you don't hear about West Nile much anymore, do you? Hopefully it's something like that. Hopefully it's not any more of a long-lasting epidemic than that. Of course, it's this has hit our economy fairly hard. If you follow the stock market at all, of course, the Dow and the S&P 500 seem to be dropping by 500 to 1,000 points almost by a daily basis during the week, and lots of companies are going down. So, let's hope this doesn't cause some kind of a recession. I've heard some people say that. I mean, I don't know about that. I think it'll probably be something that blows over, hopefully speaking, as they kind of scrambled a little bit to kind of come up with maybe a vaccine and things along that nature. But yeah, folks, just be safe out there. Be safe out there. But just know and take solace in that you can get coverage from Medicare and your Medicare plan to get your tests done and be diagnosed and the whole 9 yards. Okay. As always, folks, thanks so much for taking some time to listen to me. I mean, I know this episode's shorter than normal. We got 2 dynamite episodes coming to you on Wednesday and also on Saturday. And not only that, we are just coming off of a week where we had some really fantastic episodes this past week. On Wednesday, we came out with an episode where we interviewed Ali Salah from Strong Family Financial. That was a really fantastic conversation. If you missed that one, I encourage you to go listen to it. And then we also had a really, really good interview with Tracy Lonesberry from Michigan. Came on to talk about annuities and investments and those kind of things for people on Medicare and people over the age of 65. So some really great episodes we just got done coming off with. This week, it's just going to be me. You're going to be stuck with me all week. So there's that. Okay. As always, folks, just wanted to make sure that we remind you that the insurance funnel, 9 simple tests every insurance policy must pass before purchase, is available on Amazon. So go check it out. Christian Brindle. It's a beautiful blue book. You can basically use any insurance policy and put it in the funnel. If it doesn't pass all 9 tests, it's not worth buying. So go pick it up. It's a great book. Really, really excited about it. Not only that, folks, just wanted to remind you that if you need help with your Medicare, you can contact my organization. We are now licensed to do business and work with people in the states of Utah, Colorado, Idaho, Oregon, Texas, South Carolina, Virginia, Florida, and soon to be California. One day we'll be all done with California, but it's quite the process. Again, that is Utah, Idaho, Colorado, Oregon, Texas, South Carolina, Virginia, Florida, and soon to be California. Getting close to 10 states now, folks. My office number is 801-255-5340, 801-255-5340, or you're welcome to shoot me an email at christianb@xmission.com, CHRISTIAN, B as in boy, at xmission.com. I respond to most emails. If you send me an email and you just want to tell me how much I suck, or something like that, I'm not going to respond to you. I'm not going to give you the time of day, okay? 99% of our emails are not like that, but every now and then we get one. I mean, the bigger this podcast gets, the bigger this audience gets, the more people are not going to like me. and I really don't give a damn. I do this show the way I want to do this show, and it seemed to have worked because it's helped a lot of people. It's touched a lot of people, and the audience seems to get bigger and bigger every single week. So, as always, folks, thanks so much for taking the time. One last thing I wanted to mention: we're still doing our giveaway. First 3 people to leave a 5-star review on either Apple Podcast or Stitcher Podcast. Say something nice. You have to say something. You can't just leave their star review. Take a picture of it. Send it to me in an email to prove that you did it. Give me your name and the best place I can send you a book, and I'll send you an autographed free copy of The Insurance Funnel, no strings attached. First 3 people, and this goes until the end of March. So make sure you do it before you run out of time. Thanks so much for taking the time, folks. We'll be back with you Wednesday. Take care.